The Strengthening Communities podcast is brought to you by Access Services. Join us as we talk with the Montgomery County Overdose Response Team.
So thank you guys for joining us today. Good to see you again, Mike, in the middle of summer.
Always good to see you, Mark.
And as our listeners know, the purpose of this podcast is how we as Access, as an organization, can strengthen the communities that we're providing services in. And this season, we've been really talking, because it's our 50th anniversary, we've been talking about the impact that Access has had in the community, and not only the lives of people in the community, but the community itself, and also what impact our work has on us as people who have been doing it. So we've just been talking through a lot of the impact stories that we've had. And so today we have a really cool thing. MCORT is with us. We have some guests from there. They're going to introduce themselves in a minute. But the thrust of this, the point of this episode is how partnerships work. And we know at Access that we have a lane. We have some things that we've learned how to do to provide services to folks, to engage people in the community, but we can't do that without partners. And so MCORT is a great example of how partnership leverages up all the things that we can do on our own for a bigger impact in the community. So that's what we're going to talk about today. So welcome, guys. Maybe if we could just go around, you can introduce yourself and say who you are and what you do at MCORT, and then we can explain a little bit about what MCORT is.
My name is Ivan Rosa. I'm a lead crisis worker and CRS on the MCORT team.
Good morning. My name is Alvin Wong. I serve as the program director and the chief medical officer for the Montgomery County Department of Public Safety, and was involved in the founding of the MCORT team back in the beginning.
Hi, I'm Marlon. I'm a lead CRS and CFRS for MCORT and Mobile Crisis.
Do you want to just say, just for a second, what those words mean, what the letters mean behind that?
Yes, CRS is a certified recovery specialist, so I am a person with lived experience in recovery. And then CFRS is a certified family recovery specialist. So I also have lived experience with loved ones who struggled with addiction.
Nice. And we'll get into why that's important, but thanks for letting people know who might not understand those letters. Thanks. And then last but not least, Jonathan.
Good morning. I'm John Servin. I'm the coordinator for MCORT and also a paramedic with the Department of Public Safety.
Nice. So we've used the acronym MCORT a couple of times. Maybe we should just start there. What is MCORT and what does it do? And sort of what does a day look like in MCORT?
I can start off, and then maybe John and Marlon can jump in and Ivan with the day-to-day. But MCORT is the Montgomery County Overdose Response Team. This is a very unique team. It combines a specially trained paramedic, mobile health integrated paramedic, along with the certified recovery specialist or certified recovery specialist, who is an individual who is in long-term recovery and is cross-trained as a crisis worker. So I think that the three capabilities combined into a single response unit is what makes the program really unique. The day-to-day really involves a couple different facets. We respond in real time to overdose events as they occur throughout Montgomery County. We do this in direct partnership with the Emergency Dispatch Center at the 911 Public Safety Center here in Montgomery County. And then we also handle a bunch of longitudinal referrals that we address throughout the day during times between calls. And these referrals come from EMS, hospitals, public safety agencies, treatment organizations, and community partners with the MCORT program. And then the program in itself is very unique in that as an MIH program, we try never to duplicate an existing service line, but we really do our best to bridge gaps, lower thresholds for access, and bring services directly right to the patient rather than bringing them or having them go somewhere else.
Maybe just before we talk, maybe I can follow that up just before we talk about the day-to-day, what it looks like. But you've talked about reducing a threshold. You've talked about increasing accessibility. Why is that important? And maybe, I think we all know that there's a crisis of substance use and the opioid epidemic is really big. We know of it. But how big is it? What is it like in Montgomery County?
So Montgomery County is a great place. We are very fortunate to have a tremendous support from our county's leadership in addressing these issues. And really, without their partnership, we couldn't be in this workspace whatsoever. All that being said, that we recognize that after an overdose event is a very unique period of time in an individual's life. We refer to that as potentially a reachable moment, a moment in time during which there's been an acute decompensation or a significant event. And as part of that, really we are used to giving care in public safety and EMS. We're used to giving care in that situation. But really what the MCORT program is about what happens next, right? So surviving the overdose isn't the intervention. It's actually the start of our next opportunity to help and connect people with services. And that's where that program comes into play and takes effect.
And so you have to be with the person in that moment, which I think is sort of the mobile aspect of it. If I have to get to some place in order to get that help, you might be missing, that window of reachability might be missed. And so bringing it to the person is sort of how you get right into that spot of reachability. Yeah, that's cool.
Exactly. Yeah, that opportunity can be relatively brief. And so anything that we can do to be there and be present when that window is opened is really the key to the program's success. And every moment of delay, unfortunately, whether it's delay for access to care, delay for treatment, can result in like continued exposure to that environment, continued exposure to those risks of a repeat overdose event. And obviously, there are aspects of addiction itself that make this system relatively difficult, right? There are withdrawal symptoms and comorbidities and cravings that all play into this reachable moment in time as well.
So that lays the groundwork or the context for it. You guys want to talk a little bit about what goes into a day? You're responding to things throughout the day. What does that look like for you guys?
So an average day, it varies. We respond out to the 911 calls, so live calls, like Dr. Wong said. We do a lot of follow-ups as well. So we might have days where some are busier than others, but there's always something going on at MCORT. So not only, responding out to the live calls, doing the follow-ups, but we do outreach visits. So, the unhoused population, we are, in good graces with them as well. We respond to all the referrals from EMS and law enforcement, and assisting individuals getting into treatment programs are, exactly what our goal is. It might even just be having a meaningful conversation, but, some days, we have to kind of have a quick intervention, but other times we may have a little bit more time on like long-term engagement and follow-up. But, reducing harm and connecting people to recovery is basically the same goal.
Yeah. And I can speak from like the CRS perspective. My day usually starts with bullying John into getting me a coffee. That's important. And then we get a lot of referrals from either mobile crisis, like John and Alvin were saying, from like the 911 dispatch. So all of those referrals get handled day of. So we're making hospital calls, we're calling family members who called 911, we're calling folks directly. We go out, we call them any times, but we, go out to people's homes and try to engage with them. And like they were saying, there are definitely a lot of times where that, we show up immediately, like after the overdose has happened, and support with getting people into treatment. But there are a lot of other times too where what we're doing really is rapport building and getting to know folks, who are in active addiction, and just kind of show up for them over and over again, because that is what helps in the long term. Is, someone will have, I know this has happened to Yvonne, there people, he'll give out his card. Months later, someone has that card in their wallet and they decide that's the moment they want to call. And that doesn't happen without that like face-to-face interaction and engagement, and them knowing that they can trust us. And I think the other piece of this too is, when we arrive on scene, the CRSs on the team are in plain clothes, and we're not showing up as someone who's going to get them in trouble, or they're not afraid of us in any way. And we can just kind of go in there and be like, what's going on? What led to this? What do you want? We treat them with a ton of respect and dignity, and remind them of their humanity. And, that is it's just very meaningful. And that, I think, is kind of what's very special about our program, is that, like, dual roles.
It seems like when we're talking about that window of readiness or that moment where people might be saying, okay, today's the day. Wow, that was a big thing. That was scary. I maybe today I'm ready. That you're building that slowly in the background all the time. And it seems like that's important, because in a service system, we sort of think about, well, intake, and then we just sort of think about a process where somebody just shows up and wants some help. But you're building a relational context for ahead of maybe that window, but so that when it happens, people can accept help more readily because they know who's offering it. So it just seems like that's just really, number one, a really key part of it. And number two, maybe something that people don't always, in the public, might not always realize the importance of. It seems like it's not direct, and I'm not getting help today. So was it important for me to be out in the whatever the weather was at somebody's place, to talk to them? It is important because you're building that relational capital for when that moment arrives.
And kind of to double down off that, like how critical the trust element is. Kind of a question tied to that is, how long has your program been in existence, and how did you go about kind of initial steps of letting the community know that you're here and you're starting to build that engagement and trust with folks? So kind of a two-parter, like when was the birth of the program, and how did you guys go about that initial engagement and building of trust and rapport?
The program was really envisioned way back in 2018. There was some thought that the county could create a pathway for individuals who had an overdose event to be transported to a central location for what we call a warm handoff or connection with recovery services and some medical stabilization. And all of that is a novel idea. We always advocated for an even lower barrier approach, and one that actually brings that entire resource community directly to the patient's bedside. And that's what we do in EMS and public safety. We bring the services to the patient. And so we kept talking over the years. And with the start of the pandemic, the mobile integrated health program at Monco actually started doing a lot of pandemic related services for vulnerable populations. We were providing vaccines for seniors in congregate housing, those who are non-domiciled, and for first responders during the pandemic. And every piece of equipment that we bought during that program was actually designed so that it would have a second life at the end of the pandemic with this MCORT program. And throughout those conversations, we continued our work with the county. Our first call was really to Access as great partners with the county in various domains of public safety, whether it's mobile crisis or the outreach teams that Access operates, and really to develop that partnership between having a uniformed paramedic and a recovery specialist / crisis worker who is really able to most directly engage. And I think that hybrid approach is really what brings trust and credibility, which is a theme that we've always talked about, right? We need to have some aspect of a medical safety net, medical monitoring, medical screening, coordination with existing EMS and public safety entities. But we also need to be able to reach patients in a manner that traditional public safety can't. And we fully recognize that we have wonderfully trained law enforcement officers, paramedics, who are able to engage and understand the correct language and the correct approaches to use. But in reality, and as an individual without that same shared experience, we can't reach people in the same way. And that's where the true power of this program comes in. It's that partnership with Access and the recovery specialists that are embedded with this response team.
Yvonne, you want to talk a little bit about how you got involved? I know a little bit of that story, but not a lot. So just sort of what was it like for you to come in into the crisis, the mobile crisis team, and then also into the MCORT team?
Okay, so I started as a CRS and CPS in Philadelphia. I kind of transitioned into crisis work and MCORT. It was something that was near and dear to me. I like being like boots on the ground, like I like being the first wave that the person encounters. And the reason for that is that I feel like we're the in between, right? There's the overdose, the hospital, the treatment site, but we're the in between, right? We're always gonna be there. So for me, when I came onto the team, it was more about, okay, I've been there. I want to be the person that engages with these individuals because I want to be able to show compassion. I want to be able to show empathy. I want them to know that I get it. And it's had its moments, right? Being a person that is sort of like the first line of defense, or how can I put it? You're the first person that basically this person is gonna see when he comes out of that overdose or is at the hospital. You get to see their triumphs. You get to see when they succeed, but a lot of times you get to see their failures, right? Or not even their failures, their relapses, right? And just being able to be there and be present, and like Marlon said, you give them that card, and that card travels. I've seen people get MCORT cards as far as Bucks County and as far as Philly, and them to call in for help from those areas. Like, hey, I got this card in the hospitality center in Montgomery County, and it's that reach. MCORT has that reach, right? That transcends everything: crisis, mental health, substance abuse, medical issues. We're always gonna be there, and being that we're duly trained, we can engage on the mental health side, on the substance side, but also on the human side. Like, we get it, we've been there. So what I could say, has it been for me to jump into this work? It's really satisfying. It's really sad. It's satisfying work, and I think we all do this work outside of work. A lot of us do this work on our day off, on our time off, on our personal time, with our family, with our friends, with individuals. I saw an individual in Philadelphia. I got out, had a conversation with him, and was able, thank God to the connections that I made in MCORT, I was able to get him a bed and have him, right? Because it isn't about just MCORT. It's about how can we be contagious with this work to other individuals so they could also, we want to be contagious. We want people to get what we're getting, to get the model that we're getting, to get it, right? And for more people on a larger playing field to be able to reap the benefits of something like MCORT. And MCORT continues to grow. I came in when it was just, we're going to respond to an overdose. Now it's, Narcan, buprenorphine, mental health, street medicine, street outreach. Like, it's just, MCORT has incorporated itself into the fabric of the community in Montgomery County. And that didn't happen overnight. It took a lot of work, but now it's just happening organically.
I was just going to say it's so important to do and so challenging to do, to build a community of practice, to say, look at this thing that we've created. Look at the reason that we've created it, and look at how we conduct ourselves. And you're talking about bringing an element of authenticity to it, which is when you're talking about this is what we do outside of work too. Like, you have to show up authentically as yourself, wanting to support your community and helping others build the same systems in their own community. So from that perspective, what have you guys seen both inside Montgomery County, and then also kind of the larger scale impact of your program since 2017? What do you guys see from your perspective on the general impact in the community at large?
Well, I feel like the impact that we've had as CRSs, as mobile crisis, as paramedics, is the rapport. A lot of the times, The community, especially the unhoused population, they really don't trust. It's hard for them to trust. So the fact that they've invited us into these spaces, right? That we've created, took the time to create the rapport, and now we're in these spaces, right? And they trust us in these spaces. That's it for me, right? That they can trust that I know if I call Marlon, she's going to pick up the phone. I know if I call Ivan or Brian, they're going to pick up the phone, right? I know that if I'm not feeling well and I want help, they're going to show up and their paramedic is going to make sure that I'm okay. So I feel that it's the rapport, right? It's the relationship building.
Yeah, and just to piggyback off of that is definitely, we meet them without judgment, right? Stigma's rough out there. We're trying to break that stigma, so they know that our team, especially being a relatively small team, they know we're gonna show up, at their worst time, right? And even if they're not ready for treatment, we'll sit there, we'll just have a conversation. One of the advantages, of not for EMS, right? EMS has a very short window of how long they can stay with an individual before they go on their next 911 call. We generally have a little bit more time to actually interact with this individual, get to know them. Hey, if you're not ready right now, that's fine. We're going to call you tomorrow. Okay. If you don't answer the phone, we might come and look for you just to make sure you're okay. And we've had individuals, that have unfortunately overdosed, multiple times. But every time we're going to try, to get in front of them, to just have a discussion with them. And it's those connections, I think, that make MCORT work. Because this population doesn't always, get the care or get the, just getting in front of them, knowing that we're going to be there for them. It's more of a compassionate community, if you will.
I think we also have what's great about our role is that we have a much broader scope of harm reduction. It's not just Narcan and test strips, which those things are very important, but for us, harm reduction is also, where are you getting your next meal? Do you need to be connected to street outreach? I work alongside street medicine on Tuesdays, and a lot of it, building the trust for them to come to me for treatment later is handing out a snack or giving them a referral to JRS, to, justice related services, or Starting Point, or any of the other things that they need. Because human beings who are in addiction, that their addiction isn't the only thing that's going on pretty much ever, right? There's all these other things going on that they need support with, and the more that we can connect them to and help them with, the more they're going to trust us later with something that's very sensitive to them.
I think those are incredible perspectives that you shared, and that resource is truly needed. Mike, to answer one of your original questions, which is the impact here. I think obviously there's a significant patient impact, but I would take maybe just a slightly different angle too. And I think there's impact in the first responder community as well. And by that, I mean, I'm an emergency physician. My full-time job is in some very inner city hospitals, where, unfortunately we do see a significant number of individuals who have overdose events, and they come to the ED for care. But our paramedics are incredible. When they arrive within minutes, they reverse an overdose, they support breathing, they bring the person to the emergency department, they saved a life. But then to return that individual back to that exact same environment again, where they had that exact overdose event, the same circumstances, the same crisis, the same conditions, that can be really frustrating. And unfortunately, I think that carries over into the public safety domain as well, where our police officers, our paramedics, our EMTs might feel some of those same frustrations. And really, we sometimes call that burnout or compassion fatigue, but really I think it's moral injury, right? It's these individuals, these helpers got into this world to provide help and services. And when they are faced with a system that doesn't allow them to provide that, it can be really frustrating and lead to those feelings. And so in reality, I think one of the impacts of MCORT is it does give an opportunity for first responders to make a referral to a service that will meet their patient in the same environment they're used to being in, their home, they're wherever they happen to be, whether it's a shelter or whatnot. and we can speak the language of first responders, help with them to engage with their patients, our mutual patients, and then provide those ongoing connections to care that they may not always receive in a traditional public safety or first responder environment.
Wow, that's just really cool. And I think there are a couple of things that I'm thinking while I was listening to you. One is what we say is sometimes what I like to say, it's not just what we do, it's how we do it that really makes the difference in the work. And so I was listening to, the idea, Yvonne, where you were talking about this is becoming contagious. And we want just the community itself to sort of spread that contagiousness around. This is a thing that everybody can get connected to, or people can know about and use, even if there isn't like this direct referral coming specifically to them. And then the other thing that I was listening to was just this becoming part of the fabric. And so you guys are becoming part of the fabric of the service system. And so if I'm a doc in an emergency department, I know that there's a connection that will help me feel really good about my piece of this person's day, knowing that someone else is picking up the pieces that maybe I'm not able to do, or as you were saying, John, about a typical emergency responder might not be able to stay with a person for very long, and you guys have the capacity to circle back. So it's sort of woven into a larger piece of fabric that is able to respond in a bigger way. So that's really cool. It also leads me to sort of a question, and I think Alvin, you were starting to get there, which is what's the driver for you? Like, what is the thing that this is rewarding to you? There's something about it that makes this work something that you want to do. And so what are some of those things for you guys?
For me, I guess I have such a tremendous sense of appreciation for this team and this program. As I was alluding to, I've been an emergency physician for, close to 15 years now, and it's challenging, but and I personally, I'll share, I was getting frustrated with the cycle that we talked about. And I'm so grateful for this opportunity to be a part of this program, to have, had the trust of the county's leadership and the commissioners to allow us to fund and create this program. Because for me personally, without this outlet, without this opportunity, I'm not sure where I would be career-wise. And so, I would say I'm so thankful for this. But really, like, emergency care it's not just a temporary, intervention, right? It's not just an opportunity to prevent death or harm, but it really should be the opening of a door of a pathway towards like health and stability and recovery. And to that extent, we know that substance use disorder, it's a medical condition. It's not a moral failure. It's not a behavioral issue in and of itself. And with that, we recognize that there are medical treatments, buprenorphine being one of them, medications to help reduce withdrawal effects and cravings for medications and substances. But we need to deliver that care, that medical care, in an environment of dignity and respect. And that's what MCORT does. And to have this additional time with the patient, to have clinicians on the EMS side, on the behavioral health side, that really are focused on this work, that's incredible. And so, again, I have such gratitude to the team, and to the leadership for allowing us to run this program.
And like Dr. Wong said, it is frustrating. Working on the ambulance, sometimes you have these individuals who call often, and that's not the problem. It's bringing them to the hospital, knowing they're most likely just going to be put in the waiting room, or because at that point they're relatively stable. So having the ability to actually get these individuals directly into treatment, directly into a program, or at least give them the guidance, is huge to me. I'm a people person. I like talking to everybody. It's nice to have those relationships, especially you see these individuals a year or two later and they have a job, they have a house now, they completely, turn their life around, and it's nice. It's nice to see that.
So I'm in this, as a certified recovery specialist. So in a big part, it's because I have lived experience in addiction and recovery. And so I know it's possible. And I want to, give that hope to other people. But more so, like, my underlying core reason for doing this work is because I understand the way that trauma, especially in childhood, impacts um, people with substance use later in life. I'm very into, I can nerd out on all the psychology stuff. I'm very into how, there's that like ACE test, which is like adverse childhood experiences. And if you score, a 4 or 5 or higher, you're 700% more likely to struggle with alcoholism later in your life. And that was very true for my experience. Was a lot of my addiction stemmed from trauma, and trying and having PTSD and trying to numb that in any way that I possibly could. And that story it shows up all the time in our work. It's very, very rare that we speak to someone who doesn't have some kind of major trauma, whether it was in childhood or an accident that led them to be prescribed opioids. There's that piece is like always there. And I think what I want to do in this work is be a space where people can open up about those things and people can feel safe to start healing those things. My favorite Brene Brown quote is about how shame can't live in the light. And so when we start talking about the things that have happened to us and the things we've overcome, we can start to like tackle healing them. And that's not always going to look like going to treatment right away. But, it may look like just talking to someone or going to therapy or going to a meeting or, figuring out where your next meal is coming from. Like, it can look like anything. And so that's why I'm in this. I just want to give people hope that things can get better.
One of the things that Mike and I have talked about, one of the threads from this whole podcast has been sort of the idea that at the end of the day, we're humans helping humans, and we're really sort of we might be service providers doing a service, but we are really humans helping humans, and I think you described that, Marlon, as just these are things that we can all relate to because either we've experienced them or something like it, or we know somebody who has. And so being able to say, we're providing a service, but we're doing it in such a way that we understand the humanness of it. So I think that's just you've touched on that really important theme that keeps coming up for us in these conversations about why people do what they do. So thank you. One of the other questions that this sort of leads to is, because this is sort of fundamentally based on that humanness aspect. People who live out in the community see parts of it or see glimpses of it, either in their own lives or coworkers or friends or family. And I'm wondering, how can I, as just a citizen, do something that either promotes the work that you guys do, or the broader sense of how do I help folks who might be struggling in some way, or help the community itself get better at acknowledging it, supporting it, maybe destigmatizing it, like those kinds of things. What is there to do for the broader community?
Yeah, so there's a bunch of things that the community members can actually do. Education first and foremost. Addiction is a disease rather than, like Dr. Wong said, a moral failing. So we have to, help reduce the stigma, understand, exactly what addiction is. Individuals can learn how to recognize an overdose. Carrying Narcan, which obviously can save a life. And there's a lot of programs out there that offer free training and distribution of Narcan, our program being one of them. And, support your local outreach programs. There's a lot of outreach programs out there, a lot of ways you can volunteer, or simply just spreading the awareness. And, it can strengthen the community resources that are already in play.
Yeah, I think those are great points. We certainly advocate for public access naloxone. We encourage people to sign up for the Pulse Point app in Montgomery County. That's an app which, if you are in a public location, would alert you to someone who is nearby within a quarter mile who has a cardiac arrest or even an overdose event, who needs help. And if you feel so inclined and you're able to help, that's a great opportunity for you to intervene and to be a part of the solution and to be a rescuer. Um, the John's point about learning those local resources, that's huge as well. A very unique aspect of MCORT is that we recognize that there are many there are many programs in this workspace, and so our goal is actually never to duplicate an existing service line, and we do that by really bridging individuals who need care with their local resources. And so if people in the community know what resources are available to them, they can certainly help to amplify that message, and we're happy to be a part of that. But the MCORT program itself will never take the place of something that is already established in the community. And then, the last thing is really just the advocacy. And what I mean by that is, we are very fortunate that the funding for the MCORT program from the county has been stable, but there are voices in the community that make a huge impact. And so we need the community to advocate for this kind of sustained mobile integrated health funding, which both, supports our EMS agencies, which are in crisis, but also provides a meaningful outlet to deliver care to these vulnerable populations. And so, advocacy and support of the MCORT program with your local elected officials can be really helpful in ensuring that programs like this are allowed to continue.
I think something else that folks can do in the community is when you are engaging with folks who are unhoused, who are using substances, who are having mental health crisis, is just to remind people of their humanity. I know we tend to, when we're walking around, we avoid eye contact. We don't want to talk to the person next to us on the bus, whatever that may be, but just look at people, say, hi, how are you? Be kind, and remind, folks who are in these vulnerable situations that there are human beings who are going to treat them with kindness and dignity, because that will make it easier for them to reach out to help in the long run. And even just having conversations with people about stuff that's not related to their struggle, right? Find out their favorite sports team or their favorite movie or music, because they are a whole human being. And my favorite thing is like when we transport folks to treatment and we get that 30 uninterrupted minutes where I get to just find out who you are and, where you grew up and what you want for yourself. So I think those things are just really important in terms of like community building.
Yeah, and I appreciate what you just said in terms of all of us in the community can have a human response to the person next to us. And we may not be in a position to solve all the person's problems of the day, or parts of them that might require a response that feels bigger than us, but we can look somebody in the eye, as you said. We can find out a name, we can offer a little bit of food or a little bit of water or something tangible that makes a connection to somebody. And those as we were talking before, those are really significant things, even though they seem indirect to a problem that maybe I appear to be having today, but they're very critical.
That moment, for, like I said earlier, that in between, right? Community building and educating the community comes from us modeling it, right? We'll say, hey, I'm a person with lived life experience. They'll look at Marlon and say, wow, you don't look like you've ever done a drug in your life, right? Or they'll look at me and they say, I can't see that, right? But when we sit down and we actually let them know where our addiction took us, where we were pulled out from, right? And maybe you shared a snack. And by the way, Marlon bullies us into delivering snacks. Sitting down with a person or having a sandwich, having a snack, not just handing it to them, right? Like, I'm going to sit down here with you and eat the same thing you're eating. And I'm going to sit down on this sidewalk with you. And I'm going to give you a hug, right? It doesn't matter if you haven't showered, right? It doesn't matter. That doesn't matter to me. What matters to me is, how can I be of service to you? How can I help you? And if it's just right now, just sitting down right here and having a conversation, because no one has sat here and had a conversation with you for days, then we're going to do that. Right. And if you call tomorrow and you just want to check in, we can do that. Right. And when you're ready and you say that I'm ready, we're going to be there. Right. We always say those things, and I'm very honored to know that we stand by that. Right. We stand by that on MCORT hours. If we can't fill the gap, mobile crisis steps in, right? Or other, and we connect everybody to all walks of life to different services, whether it's to a church or to a resource center or to school and education. And they come back into the same community where they were unhoused, homeless, selling and using drugs. And now they're an advocate, they're an asset, right? So that's how you build recovery capital. This is more than just this is about building recovery capital in your community.
The really interesting thing just listening in was this, conversation about community, right? And Marlon, you had said, look people in the eye. And I think one of the points that we miss is that, unfortunately, substance use disorder is everywhere around us, whether we are aware of it or not, right? I think there are some stats. It's about 18 or 20% of the population. That's like one in six Americans have an issue with substance use disorder. But only about 20% of those are able to access treatment. And so the reality of substance use disorder, it's everywhere around us, whether we know it or not. Probably we all know at least 6 people in the world. And unfortunately, that means one of those 6 probably is an individual with SUD. And it's not just opioids, right? It's substance use disorder can take many faces. It can be alcohol, it can be benzodiazepines, it can be other substances, it can be opioids, but it's not just opioids. And so we have to be aware of it, and we have to be inclusive in the language that we use to refer to individuals who have SUD. They have a medical condition, and just like we wouldn't, make fun or point a finger at someone who has diabetes or high blood pressure, really that same substance use is the same medical condition that requires treatment, and we don't withhold treatment from individuals with diabetes or high blood pressure. We should never withhold or put barriers in the way of treatment for individuals with SED.
Well, thank you guys. I want to sort of maybe end us on just something that was said a couple minutes ago, just about we can all build recovery capital. There's you guys. First of all, thank you for what you do, and thank you for doing it in partnership, because I think we've heard just how much the partnership leverages up the capacity of each of the component parts of it to provide really a robust response to folks in need in the community. And then on top of that, just the idea that it's not just about the treatment of the moment, it's also about helping a person get on a path to recovery and to sort of taking care of the other aspects of their life that seem to be part of their human experience. And so we can all participate in that recovery pathway for somebody, even if we don't quite see the impact that it might be having in their life. So thank you guys. This was a really cool conversation. I think we can put into the credits, or at the end we can put in the contact information for both the mobile crisis program and the MCORT response. So thank you guys so much for your time today.
Thank you for having us and for this opportunity. We appreciate all of your work.
Thank you so much for listening to our podcast. We hope that you enjoyed hearing from people who are strengthening our communities every day. Search for and follow us on your preferred streaming platform to hear future episodes.